Has anyone ever gone to the doctor and had to get blood work done? Have you ever wondered how your lab techs are able to perform these procedures with such ease? Or if you're like myself, wondering why you're getting tortured with a needle just for a couple of vials of blood? Well, today's your lucky day because I'm going to tell you all about how your medical professionals are able to complete your blood tests. But don't worry, there are no actual needles in this presentation. Before I begin the demonstration itself, I would just like to tell you a little bit about venipuncture and what is needed to be able to perform these procedures. Venipuncture is the medical term given to the process of drawing blood, and if you were to break down that term, it simply means puncturing of veins. There are many reasons to do venipuncture, such as for diagnostic testing, for monitoring levels of blood components, and for administering therapeutic options such as medications and chemotherapy. And when it comes to doing the procedures itself, you will see the three most common sites that lab techs will use are the antecubital region, which is also known as the inner elbow. This one tends to be a bit easier to find the veins and it's not as uncomfortable. The next site are the tops of the hands. For myself personally, this is where I prefer to get my blood drawn, as it isn't as uncomfortable for me and it's easier for my lab techs to find my veins there. And the third site is the inner portion of the forearm, and this one tends to be a bit uncomfortable, so lab techs try not to use this one unless it's the only place that they can get something. In regards to the supplies that are needed, needles are obviously the most important part, because without a needle, you can't perform the test because there's no safe way to puncture the skin into the vein. In regards to needles themselves, there are different sizes, which are also known as the gauges, and the ones that you will most commonly see are the 22 gauges, but it all depends on the procedure getting done and the veins on the patient. And thinking about the needles and the gauges, the larger the gauge means the smaller the diameter of the needle, and the smaller the gauge means the larger the diameter of the needle. In addition to the needles, you will also see tourniquets, which can be these long rubber band-like objects that get tied around the site, and what it does is it cuts off the blood flow to that area, which allows the veins to rise up, which makes it easier for the lab techs to find the veins and proceed with the test. Alcohol pads, gauzes, and band-aids are also used, as they help clean the site before the procedure, and they help cover and protect the site after the procedure is done. Alcohol pads are extremely important because they help limit the risk of infections due to bacteria entering the skin through the needle. And finally, a sharps container is needed to be able to put the used needle into after the procedure is done. This is extremely important because the immediate disposal of a used needle helps lessen the risk of needle stick injuries, and it will help lessen the risk of transmitting diseases. Finally, I would like to show you guys how to perform these tests. So I'm going to make sure that I have all my things gathered, and before I actually perform the test itself, I need to make sure that I have prepared the site. So to begin, I'm going to put my gloves on. And once my gloves are on, I am going to take my tourniquet and I'm going to tie it nice and tight over the site that I'm going to use. And for the sake of this demonstration, I'm going to be using the antecubital region of my patient's arm. Now that my tourniquet is tied onto my patient, I'm going to take my finger and palpate the area for a good vein. And once I find it, I'm going to take an alcohol pad and I'm going to wipe the area down in circular motions. Once my area is nice and clean, I'm going to let the area dry. This is very important because proceeding with the test before the area has completely dried can cause the patient an uncomfortable stinging sensation, and it can also mess with the test results in the end. And it's also important not to touch the site because the bacteria on my gloves can get transferred to the site after I've cleaned it, which means I have to clean it again. So now that my site is completely dry, I'm going to take my thumb and about a couple of inches below the site, I'm going to drag my thumb down to make the skin nice and taut, and I can take my needle and I'm going to slowly and at an angle insert it into the skin. Once my needle is in the skin, I can take my tourniquet off and grab whatever vials I need to complete blood tests and go through with the process. And once I have finished all those vials, I'm going to take my gauze and put it on top of the needle, but I'm not going to press down. And with my other hand, I'm going to quickly take the needle out and immediately apply pressure. My needle is going to go into a sharps container. And after a couple of seconds, I'm going to check to see if there's any bleeding. And if there is no more bleeding, I can take my bandage and I can tie it and put it right on top of my sites. And then I'm finished. Now, venipunctures are a very common procedure that are done in medical facilities due to the fact that it has many purposes. They require multiple steps and supplies in order for it to be done successfully, as well as concise movements and concentration so it can be done correctly, which is why it is practiced so much in programs that are specializing in it. Now, the next time that you go get your blood work done, you can impress the person that is doing it with your new knowledge about venipunctures.